This video resource guide demonstrates the care of a well Aboriginal mother and her baby following birth and prior to discharge home. The video is designed for maternity care clinicians and has been developed in conjunction with the Victorian Aboriginal Community Controlled Health Organisation, the Koori Maternity Services and Maternity Services Education Program. The first step to providing culturally safe maternity care is to ask all women booked into your service the following 3 questions. Firstly, are you of Aboriginal or Torres Strait Islander origin? Secondly, is your baby's father of Aboriginal or Torres Strait Islander origin? And lastly, will you identify your baby as Aboriginal or of Torres Strait Islander origin? You cannot rely on using a person's appearance to determine whether they are of Aboriginal or Torres Strait Islander origin or not. The only sure way to find out is to ask everyone. If a woman identifies herself or her baby as Aboriginal or Torres Strait Islander, ensure she's been given the choice to access appropriate services such as the Aboriginal Hospital Liaison Officer.
My role is primarily at the Royal Women's Hospital is focusing on bub and mum, and that's ensuring that they receive cultural safe services within an acute setting.
Do you want me to stick around or I can go come back a bit later, sis?
Yeah, you should come back a bit later.
Okay, definitely, I'll come back a bit later. No worries, Bree, see you soon.
Firstly, we're going to focus on the examination of the mother. In preparation for the maternal examination, it's important to provide a comfortable, private and culturally appropriate environment that promotes interaction. It's important that this process is individualised to meet the needs of each woman. Okay, now you let me know if there's anything that is hurting or if there's anything that you don't understand.
Yep.
The maternal history should be reviewed prior to the examination, and the maternity care clinician undertaking this assessment must be accredited in this procedure. I've had a bit of a look at your birth history here, and I can see that during the pregnancy you were really well. There wasn't any major concerns, and it doesn't appear that there's any family history of illness, and that the birth went really well by the sound of it. It was actually quick, wasn't it? It was a quick labour.
Yeah.
Ensure all the necessary equipment to perform the examination is present and that it's been cleaned thoroughly, adhering to hospital infection control policy. It's vital to gain verbal consent from the mother prior to performing the examination. So Jane, it's a great opportunity now for us to do your postnatal check before you go home, and it'll probably take me about 10 minutes to do. Is that all right that we do that now?
Yeah, that's
all
fine.
right. The physical examination should include baby blues, circulation, uterine involution, vaginal fluid loss, perineum, bladder, bowel, posture and pelvic floor. What we're feeling is the top of the uterus, and that's where Olivia was inside there.
Yeah.
And so essentially you can feel it now. It's gone way down below your below your belly button,
Yeah.
and that's where we would expect it to be. I can feel it there now.
Yeah.
This is an ideal opportunity to discuss care of the perineum, in particular hygiene, intermittent ice packs for up to 72 hours following birth, pelvic floor exercises, pain relief, and using supportive underwear. It's also important to avoid constipation through appropriate diet and hydration. It's quite important too, Jane, to think about your posture, because all of the muscles stretch a lot when you're pregnant, okay, and your ligaments get quite softened because of the hormones of pregnancy. So when you can think about sitting up and sitting up nice and straight and maintaining a good posture here, that also helps. Sexual health should be discussed, focusing on the importance of contraception and a regular Pap test. What could be a good idea is to have a talk with your partner and think about what might be best for you. But when you go for your 6-week checkup with your GP, it's probably good to be able to revisit what contraception is going to work best for you.
Walking in the
and I should also ask, Jane, have you had a Pap test before?
No.
No. Do you know what Pap tests are for?
Something to do with your breast.
No, they're actually where we're looking at the cells in the cervix, and they're actually a really, really important part of healthcare for women, particularly when they're able to have babies. Information on the maternal care plan after discharge should be given, outlining all the details of the relevant community healthcare providers. Breastfeeding needs to be assessed by observing the mother and baby. This is usually done after the mother's examination. Particular areas to be addressed are the attachment to the breast, nipple pain, milk supply, prevention of mastitis and hand expressing. I can see here that you've been breastfeeding. How's that been going?
Yeah, it's going good, but because when she first tried to latch on,
Okay.
she didn't really latch on because it was too much milk in the breast.
If you just imagine that that's your breast,
Yep.
when it's really, really full and engorged,
Yep.
it's kind of hard for Olivia to latch onto your nipple. Right?
Yep.
So what we sometimes do or suggest is to express a little bit of the breast milk out. Have you heard about expressing milk?
Yeah, a little bit.
So essentially how we're going to do that is literally expressing it out so that essentially it will soften the actual breast tissue and allow the nipple to become a little bit more of an easier shape for Olivia to latch onto. It's good to check your breasts after you have your period, and because you're feeding and breastfeeding, your period might not come back in for quite some time. But it is good to get into a regular habit of checking. So anything that would worry us is if you've got redness or a lump or swelling or pain, or there's any sort of discharge that looks abnormal to you.
Hey brother and sis, little bub, how'd you go with the checkup?
Good.
Yeah, that's
Yeah.
yeah, all right. How was Bree? Did you understand what she was saying during all the checkups there with you and Bub?
Yep, this was.
When we're supporting a mum, when I support a mum and Bub through the clinical processes of it, I'll make sure they feel comfortable with me being there, because there might be points where they go, oh, no, I'm getting a bit shamed now. Can you just leave me with the midwife? So always kind of repeating that through the process, like, do you need me here? Do you want me to come back? It's really important to make sure that they understand medically what's happening.
Walking in the